Georgia's governor just announced a surprising plan for reopening his entire state. He's allowing a wide array of businesses that usually involve very close physical contact to reopen as soon as this coming Friday, including gyms, hair and nail salons, massage therapists. Also breaking right now, the coronavirus death toll here in the U.S. has climbed to above 41,000 as President Trump has been battling with the nation's governors over the need for additional testing. The Vice President, Mike Pence, tried today to reassure the governors that they will get federal help to obtain testing supplies. But the president has been passing the buck to state leaders, insisting they are primarily responsible for coronavirus testing, which is considered crucial to efforts to reopen the country safely. Let's go to CNN's Nick Watt. He's joining us from Los Angeles right now. Nick, you're watching what's happening all over the country. Georgia is now joining some other southern states in announcing some very dramatic plans to reopen very quickly.
Absolutely, Wolf. We have heard from Louisiana, where the governor says he hopes sooner rather than later they can open. In Tennessee, they're planning to open some businesses a week from today. We also heard from the governor of Michigan, who says, is there anybody who actually believes they care more about jet skiing than the lives of the elderly and the vulnerable? It is clear we're going to see a lot of different things in a lot of different places, and it could get a bit messy. Reopening this Friday in Georgia, gyms, bowling alleys, barbershops, and some other businesses that can't do work from home.
This measure will apply statewide and will be the operational standard in all jurisdictions.
Monday, restaurants will also reopen. Kemp says all businesses that are reopening must screen employees for illness and practice social distancing.
By taking this measured action, we will get Georgians back to work safely.
There is some relaxation some places. South Carolina expected to open stores and beaches Tuesday, which were open all weekend in Jacksonville, Florida, with social distancing rules flagrantly flouted.
I think that decision was reckless. It shows you how undisciplined the leadership of this country has been, because we do not have a consistent message.
And there are still hotspots: Chicago, Boston, Philadelphia. One more pork plant just closed indefinitely in Minnesota after an outbreak. Nearly 10% of U.S. pork production is now shut down. And cases continue cropping up at nursing homes. The CDC now mandating that residents and their families are informed about outbreaks, along with the CDC.
And we are also paying for labs to go out to nursing homes to collect samples.
Meanwhile, our leaders struggle to balance the pain of the virus.
I had the sense that I was drowning at certain points. I was unable to even stand.
With the pain of the shutdown.
You don't need protests to convince anyone in this country that we have to get back to work and we have to get the economy going and we have to get out of our homes. Nobody. The question is going to become how, when, how fast.
One influential model suggests just these 4 states can safely open first on May 4th, still 2 weeks from today.
What we are reporting is a level that a state can comfortably move to a containment stage.
That level is 1 new case per day per 1 million people. So, for example, New York State would need fewer than 20 cases per day. Right now, they're still seeing more than 5,000. All large events in the city, concerts, parades, were just cancelled through June. The governor now wants a bump in pay for essential workers.
When you were home with your doors locked, dealing with cabin fever, they were out there dealing with the coronavirus. I would say hazard pay, give them a 50% bonus, and I would do that now.
Apparently, at 1 new case per million per day, a state will have the capacity to care for that patient and also trace and test their contacts. Bottom line?
Unless we get the virus under control, the real recovery economically is not going to happen.
Now, Governor Kemp in Georgia says he will give us some more details in the coming days about just how this will work. I would like to know if it is possible to social distance while getting a haircut, a manicure, or a massage. Wolf?
All right, good point. Nick Watt reporting from Los Angeles. Thank you. Joining us now, the governor of Maryland, Larry Hogan. Governor, I know you're incredibly busy right now, but thanks as usual for joining us. I don't know if you heard, but the president just a few moments ago spoke about how the White House actually provided a list to the governors of additional testing capacity in their states. And then he singled out you, saying you didn't really understand that list. He said, some of the governors, like as an example, the governor from Maryland, didn't really understand the list. He didn't understand too much about what was going on. It was bipartisan criticism, by the way. You're a Republican. He also criticized Democratic Governor J.B. Pritzker of Illinois. How do you respond to the president at a time like this? He's singling you out and Governor Pritzker for criticism.
Well, I don't want to get into criticizing back and forth, Wolf. The president was not on the call. I thanked Vice President Pence and the president's team that was there for all the progress that they've been making. But I actually started off the discussion on behalf of the governors and thanked all of them for the progress in many different areas. I think what the president may be referring to is that they sent out a list to each of the governors of all of the different lab facilities in their states, which most of the governors already knew where the lab facilities were in their states. I happened to bring up at the beginning of the meeting, well, we appreciated that list. More than half, most of the ones that they sent me in Maryland were all federal facilities, including NIH and FDA and Walter Reed and multiple Fort Detrick and Aberdeen Proving Ground. So they were either federal health facilities that we've been desperately trying to get help from, or military installations, none of which were state-owned labs or facilities where we could actually do any testing. But I'm not sure what the president's referring to. I have a pretty good understanding of what's going on, and I appreciated the information that was provided by his team, but he wasn't there for, I'm not sure what he was trying to say. Yeah, well, and you're the chairman of the National Governors Association, so you're the leader of all of 50 of these governors who were on the call with the vice president. Earlier today, and you announced the shipment of tests coming into Maryland from South Korea that will allow you to conduct 500,000 tests. This is a dramatic development. How did this deal come through? Well, as you know, the president has been repeatedly saying that the states should really be on their own, or not on their own, but they should take the lead on doing testing, that the federal government would back us up, but that the governors needed to go out and get their own testing. And we've all been out there, the governors, trying to compete with one another all around the country and around the globe to try to get testing. This is a huge development for us. We've been working on this for about 22 straight days and nights. My wife, who's originally from South Korea, we have a pretty good relationship with the president of South Korea, with the ambassador here in Washington, and we've been negotiating back and forth with Korean companies. We were able to get 500,000 tests that landed at Baltimore Washington International Airport on Saturday. It was a tremendous accomplishment for us. We're very excited. Still got a lot more work to be done, but that's more than the total amount of testing that has been done in 4 of the 5 top states in America so far. Because testing is so critical right now. But what does it say, Governor, about the state of testing in the country right now, that you, the governor, had to turn to South Korea to get what you needed? Because normally the federal government would be dealing with South Korea. Well, look, we're just happy to have the help from the Republic of Korea, and we want to thank the federal government for their assistance as well. We're going to need some pieces and components, things like swabs, which we talked about today on the call. The president says that they're ramping up production of swabs, which is critically needed, about reagents and some of the things that we still need help on from the federal government. But we're happy to have made progress. I know that some of my fellow governors are all out there working hard, doing the best they can to find testing capabilities wherever they can find it, anywhere in the domestic market or anywhere around the world. Your colleague, Governor Kemp of Georgia, Brian Kemp, he announced today, and it's pretty dramatic, we've been reporting it, and I want to get your reaction, that there will be in Georgia what he called an incremental reopening of certain businesses, including gyms, fitness centers, bowling alleys, body art studios, barbers, hair and nail salons, massage therapists as early as this coming Friday, and that theaters and restaurants can open in Georgia next Monday, a week from today. He says bars, nightclubs, and music venues will remain closed
for now. Well, what is Maryland even close to any of that? What's your reaction to that?
Well, the governor of Georgia is a friend and a colleague, and I can't really speak to what the situation is on the ground in Georgia, but I can tell you that, here in Maryland, we're going to be announcing later this week, kind of a well thought out, gradual plan that's based on the sciences. We're trying to get our economy opened as quickly as we possibly can, but we want to do it in a safe way. And we're following the guidelines that were just put out by the president on Thursday evening, which call for downward numbers for over a period of 14 days, which we don't have. I'm not sure what the situation is in Georgia, but a number of states are still not at that point where we're able to do that quite yet.